Hello, everyone. This is Dr. Jennifer Teal, and I put together this presentation to give you just some basic information on what ICD-10 coding is all about and how that fits in with the other code sets. So what exactly is coding? According to the basic ICD-10-CM PCS coding textbook, quote, in its simplest form, coding is the transformation of verbal descriptions into numbers, end quote. Medical coding is the process of assigning alphanumeric representations to the clinical documentation in the health record. The codes are used to describe diseases, injuries, and procedures. Coded data is used for many purposes. Not only is it used for reimbursement purposes, but is also used by statewide registries to track disease processes and treatment, for research purposes, by vendors to improve medical equipment, by hospital administrations to determine revenue-generating trends, for quality improvement activities, and to improve overall services provided by medical facilities, just to name a few examples. It is important to realize that as a coder, you are impacting a great many processes, not just the insurance billing. One other thing to note is that the codes that you assign must always be supported by the documentation in the health record. We have a saying in medical coding, and that is, if it isn't documented, it didn't happen. Under the Health Insurance Portability and Accountability Act, or HIPAA, the Department of Health and Human Services adopted specific code sets for diagnoses and procedures to be used in all transactions. These are the codes with which providers and health plans are familiar and are the adopted code sets for procedures, diagnoses, supplies, and drugs. So you see here on the slide, I have several different code sets listed. We have HCPCS, CPT, ICD-9-CM, ICD-10-CM, ICD-9-CM Volume 3, and ICD-10-PCS, NDC, and CDT. So ICD-9 is the precursor to ICD-10. So you might still hear people refer to ICD-9. And if you're doing data mining and research and things that took place for dates of service prior to the implementation date of ICD-10, then those codes would still be reflected in ICD-9. So it's important to have an understanding of ICD-9, even though current state we are coding in ICD-10. So that first code set listed, HCPCS, that's the Healthcare Common Procedure Coding System, which was established and maintained by the Centers for Medicare and Medicaid Services, or CMS. It primarily represents items and supplies and non-physician services that are not covered by the American Medical Association CPT-4 codes. So CPT-4, or current procedure terminology, those codes are used to describe medical procedures and physicians' services and is maintained and distributed by the American Medical Association, or AMA. These codes are used for outpatient procedures and physician professional services. HCPCS and CPT codes are often used together. Next, we have ICD. So the International Classification of Diseases, 10th Revision Clinical Modification, or ICD-10-CM, is used for diagnosis reporting on both inpatient and outpatient. ICD-10-CM replaced volumes 1 and 2 of ICD-9-CM. Next, we have the International Classification of Diseases, 10th Revision Procedure Coding System, or ICD-10-PCS, which is used to report procedures for inpatient hospital services. ICD-10-PCS replaced Volume 3 of ICD-9-CM. The National Drug Codes, or NDC, is a code set that identifies the vendor or the manufacturer, product, and package size of all drugs and biologics recognized by the FDA. And then CDT is the code on dental procedures and nomenclature, and that's the code set for dental services. It is maintained and distributed by the American Dental Association. So all of these are the HIPAA approved code sets. As a medical coder, what you're going to be exposed to in this current state, because we're no longer coding in ICD-9, so you're going to be exposed to ICD-10, CPT, and HCPCS. And it really depends on what environment you're working in. So whose services you're coding for. So to kind of explain to you how these things fit together, your diagnosis or condition, or the medical necessity, the reason why a patient requires a certain service or procedure, that is captured with your ICD-10-CM codes. So your ICD-10-CM codes are utilized across all settings. So you're going to assign those diagnosis codes, whether it's an inpatient or an outpatient, whether you're billing for the hospital, whether you're billing for the provider, whether it's the professional bill or the facility bill, you're still going to utilize ICD-10-CM codes for the diagnosis. That tells the story of what is wrong with the patient or why they presented for services. It justifies the medical necessity. Now, your procedure codes will vary depending on setting and for whom you're billing. So if you're in an inpatient environment billing for the hospital, your procedures will be captured with ICD-10-PCS codes. If you're in an outpatient setting, no matter who you're billing for, whether it's the hospital or the provider, you're going to use CPT and HCPCS codes for the procedures and services. So for your outpatient settings, CPT and HCPCS. So now the little caveat is on inpatients where you're billing for the physician and not the hospital. So physician services are always captured with your CPT and HCPCS codes. So even on an inpatient, if you're billing for the physician services or what we call professional fees, you're going to be using CPT and HCPCS codes. But you'll still use those ICD-10 diagnosis codes, the ICD-10-CM, because again, those are used across all sections. So, or all settings, excuse me. So how they all work together is important to understand, because as a medical coder, you're going to need to know what code set am I to use depending on what type of coding I'm doing. So now let's turn our focus for this presentation on ICD-10-CM specifically. Before you can code, you need to understand the coding conventions and guidelines. They were developed by the Centers for Medicare and Medicaid Services, or CMS, and the National Center for Health Statistics, NCHS. And they have been approved by what we call the four cooperating parties. The cooperating parties, four organizations that make up the cooperating parties for ICD-10-CM. And that is the American Hospital Association, AHA, the American Health Information Management Association, AHIMA, CMS, the Centers for Medicare and Medicaid Services, and again, National Center for Health Statistics, NCHCS, or NCHS. So again, four organizations make up the cooperating parties that are responsible for developing the coding conventions and guidelines. You can find the official guidelines in the front section of the ICD-10-CM coding manual, or you can also locate a PDF version online by doing a simple internet search. Any search engine of your choice, if you just type in ICD-10-CM, official guidelines for coding and reporting, they will come up. and you can get a PDF version that you can keep handy on your computer desktop. Sometimes it's just easier to do like a word search or something like that. So it is a nice thing to have handy in addition to what is in your actual code book. Let's talk about the sections of the coding guidelines. As you can see here on the slide, the coding guidelines are divided up into sections. And these are Roman numerals. So it's Roman numeral 1, Roman numeral 2, Roman numeral 3, Roman numeral 4. So section 1 is your coding conventions, your general coding guidelines, and all of your chapter specific guidelines. The code book is arranged into chapters. So that's what we mean by chapter specific guidelines. Section 1 includes the structure and conventions of the classification. So your basic coding concepts. Very important that you become familiar with section 1. Read the coding conventions, the general coding guidelines. The chapter specific guidelines you want to kind of do a cursory review of, and then you can focus more heavily on those when you are actually coding from a particular chapter, because there's just way too many to try and commit to memory. But you do want to give them at least a good run through one time so you know the types of things that they cover. Section 2 of the guidelines include the selection of principal diagnosis for non-outpatient setting. So if you're coding for inpatients, it's very important that you understand the concept of principal diagnosis. Section 3 includes guidelines for reporting additional diagnoses in non-outpatient settings. So how do you determine what's the principal diagnosis? That's section 2. And then what you're allowed to code as additional diagnosis during that inpatient episode of care. That's going to be section 3. Section 4 is for your outpatient coding and reporting. So it's necessary to review all sections of the guidelines to fully understand all of the rules and instructions needed to properly code. And finally, we have Appendix I, or Roman numeral 1. You'll hear it said both ways. That is your present on admission reporting guidelines. So that applies to your inpatient. Again, present on admission applies to the inpatient. So I'm going to pause for just one moment while I bring up the code book. So if you'll bear with me for just 1 second. So what you see here is just one version of the code book. There are many different publishers, and I am not necessarily recommending any particular publisher. It's really up to you what your preference is. They're all very similar, but they do have different bells and whistles. They're all just slightly different in presentation. So again, you know, there are many out there. I just happen to be using this one as an example because it's what I have handy. So this is your ICD-10-CM code book. And as I was mentioning, in the very front of your code book are the official guidelines for coding and reporting. So this particular publisher edition has some stuff here in the front that really is about how to use the book, what's new, that sort of thing. So you want to skip over that and come to the very first gray section here that is the coding guidelines. So I mentioned the various sections of the guidelines, and you can see here section 1, Roman numeral 1, is what I talked about for the general coding conventions and guidelines. And what we have here are the rules of the road. So these are the basic concepts that you need to understand as a coder in order to be able to accurately code. So take the time to review section 1A. Here's your coding conventions. 1B, these are the general coding guidelines. Really spend a lot of time reviewing. And you can see that's not that many pages. This says page 6 is where 1C starts. So the first few pages is really all we're talking about. Go over them, make sure you understand them. Then you get into what we call the chapter specific guidelines. So chapter 1 is infectious and parasitic diseases. Chapter 2 is neoplasms. Chapter 3 is going to be diseases of the blood and blood forming organs, and so on. So when I said, when you're coding something from that particular chapter, come back and review these chapter guidelines. So if you were coding any neoplasms, well, then you're going to come here and make sure that you review to see if there's a guideline specific to the scenario that you're working on. So you can read the topics right here and then make sure that you review those. So some of the general coding concepts are first and foremost, how to use the book, the alphabetic index, and the tabular list, the format and structure of codes, use of codes, placeholder characters. So these are all your basic coding conventions. So take the time to review these. And as you can see, it's just a few pages. So here's A, 2 columns there, 3 columns, and then B, the general coding guidelines start next. So you got part of a column here, then you've got 2 columns on the next page, and then you've got basically a column and a half on this page, and then we get into the chapter specific guidelines. So I can't say it enough. Make sure you refer to the guidelines. Guidelines, guidelines, guidelines. We say that all the time in coding. Guidelines, guidelines, guidelines. So get to know your book and how to utilize it and where to find the information. That's going to be very important. So let me just pause my screen sharing for a moment while I go back to the slide presentation. So bear with me. So here we are back with our slide presentation, and we talked about the sections. So once you've reviewed the coding conventions and guidelines, you need to familiarize yourself with the organization of the ICD-10-CM Codebook so that you're comfortable locating the alphabetic index to diseases, the table of drugs and chemicals, the neoplasm table, the alphabetic index to external causes, and the tabular list of diseases and injury. Those are the sections that you really need to know. And if that means putting little sticky notes to divide your sections up to help you find them easily, then that might be helpful for you. But you do need to be savvy with the code book in order to look up your codes. While many organizations utilize electronic encoder products, it's still important that you're familiar with the book and know how to use it. Also note that you will not have access to an encoder product if you're taking any of the coding certification exams. So if you want to become a certified coder and you are going to take a certification exam, you have to be very well versed in how to use your code book. The exams are timed, so if you're spending a lot of time fumbling around in your book trying to figure out where to find things, that's going to eat up time on the clock. So you just want to make sure that you take the time to get familiar with your code book now. Let's talk a little bit about using the alphabetic index. Main terms and subterms are alphabetized. Numbers appear first under the main term or subterm. Main terms are always bold print and they are flush left with the margin. The main terms represent diseases, conditions, nouns, and adjectives. So this is your starting point with coding. You start with a main term and then additional subterms if applicable. The coder always starts with the main term in the alphabetic index to locate a patient's disease or condition. Remember, main terms represent the patient's problem, such as a disease, a condition, a complaint, not a specific body part or organ affected. Subterms are indented to the right of the main term. You may also have subterms of subterms. So the indented subterm is always read in combination with the main term. And then you'll notice in the alphabetic index that some of the codes are followed by a dash. A dash at the end of an index entry means that additional characters are required before you have your final code. You will refer to the tabular list to select the appropriate additional characters. And as coders, we always say, do not code from the alphabetic index. When you're coding in ICD-10-CM, you start in the index, always start in the index, then you go to the tabular list to complete your code. Start in the index, finish in the tabular list. Never code directly from the index because you're going to miss out on some of the instructional notes that are in the tabular list. And we're going to talk about that as well. So hold on just 1 second and we'll walk through the alphabetic index so that I can show you a little bit about what I'm referring to. So once we get beyond the alphabetic index, I mean the coding conventions and guidelines, that's where we were a moment ago. If you just keep flipping the pages until you get to the end of the guidelines, you'll see here the guidelines end, and then we have the index. You see here it says ICD-10-CM Index to Diseases and Injuries. They're all alphabetized. So what I was referring to with the main terms, you see they're always bold and they are flush left. And then your subterms are indented and they're no longer bold. So you have main term, subterms, main term, subterm, main term, subterm, and then subterms. See there? So these little gray bars that go down the page, those really are a good visual clue or visual tool, I should say, to help your eye follow when you're looking for a specific subterm, for example. So if I'm using aberrant as my main term and I just want to go and look for a specific subterm, I can skip all of these subterms and just follow this gray bar and go from artery down here to breast, to endocrine, to hepatic. I can just keep going, or I could go back up here and see the gray bars continue. I have a new subterm though, see? A new main term, pardon me. So bold, right? So these gray bars, when you have sections that are quite long, abnormal is one of them. See this one here, abnormal. Let me just make this a little bit so you can see the whole page. So if you see there, abnormal is quite lengthy. So these are like abnormal test results, things like that. Something is abnormal and we don't necessarily have a specific diagnosis or condition. So we have all kinds of abnormal stuff. So we have to follow the gray bar for the next subterm. You just keep following. Okay, so maybe I'm looking for abnormal diagnostic imaging. And now we have all the subterms for that. So these indents and this gray bar is going to help you know where you're at. So very long alphabetic index. It goes all the way until you get to the Z's. And there you have the end of the alphabetic index, the Z's. Next, we have the neoplasm table. So you can see here in the margin of my book, the neoplasm table. That's what comes after the alphabetic index. And then we have the table of drugs and chemicals. That follows the neoplasm table. Then the external causes to injuries has its own alphabetic index. So whenever you're looking for an external cause code, you have to make sure that you are in the external cause index, completely separate from the regular alphabetic index. After you get past that external cause index, next we have your tabular list. So all these little colored sections were out of the gray shades and now into the colored sections. This is all the tabular list. And usually what you're going to find is a chapter is a color. So chapter 1, infections of the parasitic, certain infectious and parasitic diseases. It tells you the code range, A00 through B99, plus they've added a U code. That's all of these green pages. Then we have chapter 2. They're blue pages. There's the neoplasms. So neoplasms are all blue pages. And then chapter 3, red pages. So the color coding really helps you. So that's just a little bit about the index, how to use the index, and what else is in the front matter of your book in terms of your index and your indices and your tables. Okay, so let's get back to our PowerPoint presentation. So one moment, please. So we referenced the alphabetic index, and now we're really ready to start looking up codes. So this is when you go from the alphabetic index over to the tabular list. Again, you never code directly from the alphabetic index. Let me bring up just a little pointer here. I don't know if this is going to show up, but our main term, bold, right? And this picture here on the screen is actually what we're seeing in the tabular list now. We consulted the alphabetic index hypothetically because we haven't walked through any scenarios yet, but we consulted it and it referenced the tabular, the first few characters of the code. And I showed you the chapters in the tabular list. And that's what you're going to do is you're just going to find what chapter you need to be in. And they're all in numeric order. So you're going to find the right area and build your code from there or select your code. So here's some of the instruction notes I was talking about when I said, if you code from the alphabetic index, you're going to miss these instruction notes. So excludes 1 is a type of instruction note. Excludes 2 is a type of instruction note. You might see use additional code or code also. Those are additional instruction notes. So it's always important that you're actually working from the tabular list when you're selecting your code. So the alphabetic index is your starting point, but the tabular list is your ending point. And then also remember that any codes that have a dash after them, so like here is an example right here, J21 point, and then there's a dash. That dash means you need to go to this area of the tabular list to figure out what your remaining characters are for your code. That anytime you see a dash, you do not have a final code. Always read and be guided by the instructional notes. So I mentioned a couple of those. Your code first, code also, excludes 1, excludes 2. And those are defined in the general coding conventions and guidelines. And that's another reason why it's important to read those first, because it tells you what an excludes 1 note is. It tells you what an excludes 2 note is. So in order to understand the terminology being used, you have to refer back to those coding conventions and guidelines. And then again, even if the code provided in the alphabetic index appears to be a complete code, you still must go to the tabular list. I can't say that enough. Never code from the index. Always go to the tabular list. Okay, so let me turn this highlighter off. Go to the next slide. So let's kind of walk through what the basic steps in coding are for ICD-10-CM. What you're going to do first, you're going to take the documentation and you're going to figure out what the main term is that's included in the diagnostic statement. So first you identify all the main terms, then you locate each main term in the alphabetic index. Then you're going to refer to any subterms indented under the main term. The subterms form the individual line entries and describe essential differences by things like site, etiology, clinical type. So the subterm really adds additional specificity. You're going to follow any instruction notes. So in the alphabetic index, you might have an instruction note that says see or see also, and that's a cross-reference for you to go look elsewhere in the index. So always pay attention for your instruction notes. Then what you're going to do is you're going to take whatever partial code that it provides you, and you're going to verify the code selected in the tabular list. You're going to read and be guided by any instructional terms that are in the tabular list. Assign the code to the highest level of specificity up to a total of 7 characters if applicable. A code is invalid if it's not coded to the full number of characters required for that code. And then you continue coding the diagnostic statement until all the component elements are fully identified according to what was documented in the health record. A little bit about the code format and structure for ICD-10-CM. The codes consist of 3 to 7 characters. The first character is always a letter, and all letters of the alphabet are used. We used to say except for the letter U. So you're going to see that in this graphic here on the slide where it says except U. That was a placeholder for new things that they needed to add, and we've actually started utilizing that section now. So that except U is no longer valid. There are U codes. The second character is always a number, and then characters 3 through 7 can be alphabetic or numeric. For any codes that are more than 3 characters long, you will always place a decimal after the first 3 characters. If it's only 3 characters, so if the full code is only 3 characters, there's no decimal. But if it's more than 3 characters, you always put that decimal. Alpha characters are not case sensitive, so it doesn't matter if you use uppercase or lowercase, but do pay attention to correctly using your numbers versus your letters. Some students get confused between the number 0 versus the letter O, or the number 1 versus the letter I. Some people mix up their S's and their 5s. So always pay attention to letters versus numbers to make sure that you type them out correctly. ICD-10-CM contains both, okay? All the letters and numbers are used. So those that may be familiar with ICD-10-PCS, PCS does not use the letter O or the letter I so that they're not confused with the numbers 0 and 1, but CM does use them. So pay attention and remember to include the decimal. The decimal is important for your code formatting because without that, one, it's part of the format of the code and it's the correct way to represent the code, but also PCS codes are 7 characters. So if you have a 7-character ICD-10-CM code, how can you tell the difference between the diagnosis code and the procedure code? Or if you have an ICD-10-CM code that's only 5 characters, how can you tell the difference between that 5-character CM code versus your CPT codes? So always follow appropriate formatting with your codes. Now, a few concepts for inpatient coding. For inpatient coding, all diagnoses that affect the current hospital stay are to be reported. The circumstances of inpatient admission always govern the selection of the principal diagnosis. And remember, I told you there was guidelines on selection of principal diagnosis. So in the way of a definition, the principal diagnosis is defined in the Uniform Hospital Discharge Data Set, or UHDDS, as, quote, that condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital for care, end quote. the after study piece is very important to that definition, because for your hospital admissions, they might suspect something at the point of admission, but then after study, after they run the diagnostic tests, then they clarify what the final diagnosis is. So for your inpatients, that after study piece is important. That condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital for care. Now, for additional diagnoses, so what else can you code during that hospital admission? The additional diagnoses are defined as all conditions that coexist at the time of admission, that develop subsequently, or that affect the treatment received and or length of stay. So the definition for other diagnoses is interpreted as additional conditions that affect patient care in terms of requiring clinical evaluation or therapeutic treatment or diagnostic procedures or extended length of hospital stay or increased nursing care and or monitoring. So if it meets any of that criteria, you will assign a code as an additional diagnosis. All significant procedures are also to be reported. So remember, for inpatients, when we talk about the procedures, we're talking about ICD-10-PCS codes. UHDDS defines significant procedures as those that are surgical in nature, carry a procedural risk, carry an anesthetic risk, or require specialized training. So if it meets that criteria, you will always assign a procedure code. The principal procedure is one that was performed for definitive treatment rather than one performed for diagnostic or exploratory purposes, or was necessary to take care of a complication. If there appears to be two procedures that meet the above definition, then one must be related to the principal, then the one that's most related to the principal diagnosis should be selected as the principal procedure. So this all gets into sequencing. The rule of thumb is the procedure that's most closely related to the principal diagnosis and is for therapeutic treatment, that would be your principal. So therapeutic comes before diagnostic, and related to the principal comes before related to secondaries. If you have more than one that fit the criteria, then it's really just a matter of preference. Either one can go first. So again, review the ICD-10-CM official guidelines for coding and reporting, especially section 2, selection of principal diagnosis, and section 3, reporting additional diagnoses. So again, I want to reiterate that you must be sure to take the time to completely review section 1A and 1B of the ICD-10-CM official guidelines for coding and reporting, because that forms the foundation for ICD-10-CM coding. It's critical that you have a good understanding of the basic concepts before you begin trying to learn how to code. There are also chapter-specific guidelines, again, in section 1C. And like I stated before, I recommend that you give those a good once-over, so thoroughly read through them one time, just so that you know what's there, but then really focus on them as you're coding from that particular chapter. Then you're going to go back and re-review that chapter-specific guidelines. So the intent of this presentation really was just a brief introduction into ICD-10-CM, what it is, the various sections of the code book, the guidelines, and how ICD-10 really fits in with some of the other code sets. I hope you found this helpful, and if so, please hit that like button and subscribe to my channel. Hopefully, I'll be creating some additional content with some case scenarios where we can actually walk through the steps of ICD-10-CM coding. But this was just a little preview of what it's all about and what you need to know to get started with ICD-10-CM. With that, Dr. Teal out.